Welcome to the weekly Security Awareness Podcast, sponsored by SecuVantage. SecuVantage offers best-in-class, next-generation security awareness training for small and medium-sized businesses. Visit SecuVantage.com and sign up for the always-free Cybersecurity Kickstarter program, where you will get a free, online cyber risk assessment and tracking, ready-to-edit cybersecurity policy templates and checklists, and a library of security awareness posters. You can sign up today for instant access. Visit SecuVantage.com to get started. SecuVantage – because hackers target humans, not computers.
Headline: 110 nursing homes cut off from health records in ransomware attack. A ransomware outbreak has besieged a Wisconsin-based IT company that provides cloud data hosting, security and access management to more than 100 nursing homes across the United States. The ongoing attack is preventing these care centers from accessing crucial patient medical records, and the IT company's owner says she fears this incident could soon lead not only to the closure of her business, but also to the untimely demise of some patients. Milwaukee, Wisconsin-based Virtual Care Provider Inc. VCPI provides IT consulting, internet access, data storage and security services to some 110 nursing homes and acute care facilities in 45 states. All told, VCPI is responsible for maintaining approximately 80,000 computers and servers that assist those facilities. At around 1:30 a.m. Central Time on November 17, unknown attackers launched a ransomware strain known as Ryuk inside VCPI's networks, encrypting all data the company hosts for its clients and demanding a whopping $14 million ransom in exchange for a digital key needed to unlock access to the files. Ryuk has made a name for itself targeting businesses that supply services to other companies, particularly cloud data firms, with the ransom demand set according to the victim's perceived ability to pay. In an interview with Krebs on Security Today, VCPI chief executive and owner Karen Christensen said the attack had affected virtually all of their core offerings, including internet service and email, access to patient records, client billing and phone systems, and even VCPI's own payroll operations that serve nearly 150 company employees. Christensen said restoring customer access to this functionality is the company's top priority right now. "We have employees asking when we're going to make payroll," Christensen said. "But right now all we're dealing with is getting electronic medical records back up and life-threatening situations handled first." Christensen said her firm cannot afford to pay the ransom amount being demanded, roughly $14 million worth of Bitcoin, and said some clients will soon be in danger of having to shut their doors if VCPI can't recover from the attack. "We've got some facilities where the nurses can't get the drugs updated and the order put in so the drugs can arrive on time," she said. In another case, "We have this one small assisted living place that is just a single unit that connects to billing. And if they don't get their billing into Medicaid by December 5th, they close their doors. Seniors that don't have family to go to are then done. We have a lot of clients right now who are like, just give me my data, but we can't." The ongoing incident at VCPI is just the latest in a string of ransomware attacks against healthcare organizations, which typically operate on razor-thin profit margins and have comparatively little funds to invest in maintaining and securing their IT systems. Earlier this week, a 1,300-bed hospital in France was hit by ransomware that knocked its computer systems offline, causing very long delays in care, and forcing staff to resort to pen and paper. On November 20th, Cape Girardeau, Mo-based St. Francis Healthcare System began notifying patients about a ransomware attack that left physicians unable to access medical records prior to January 1st. Tragically, there is evidence to suggest that patient outcomes can suffer even after the dust settles from a ransomware infestation at a healthcare provider. New research indicates hospitals and other care facilities that have been hit by a data breach or ransomware attack can expect to see an increase in the death rate among certain patients in the following months or years because of cybersecurity remediation efforts. Researchers at Vanderbilt University's Owen Graduate School of Management took the Department of Health and Human Services (HHS) list of healthcare data breaches and used it to drill down on data about patient mortality rates at more than 3,000 Medicare-certified hospitals, about 10% of which had experienced a data breach. Their findings suggest that after data breaches, as many as 36 additional deaths per 10,000 heart attacks occurred annually at the hundreds of hospitals examined. The researchers concluded that for care centers that experienced a breach, it took an additional 2.7 minutes for suspected heart attack patients to receive an electrocardiogram.